Welcome back for our fourth and final mini lecture on alcohol. This is Dr. Clark. We're going to jump in here with the physiological effects, so the immediate effects of alcohol in the body. One of the physiological effects of exposure to alcohol is a change in peripheral circulation, so a change in the way that the peripheral blood vessels manage circulation. Basically, those blood vessels dilate, and the end result is that people who are drinking lose body heat but feel warm. So even though they are getting colder, they still feel warm, and that's one of the reasons why we can see issues with frostbite and that sort of thing in people who are exposed to alcohol and then to extreme cold. Alcohol also affects fluid balance in the body. This is one that people who do drink even occasionally tend to have some familiarity with. So alcohol has a diuretic effect, so it increases the flow of urine. But because of that diuretic effect, it can also lower blood pressure in some individuals. So if individuals have a low blood pressure problem, drinking alcohol may exaggerate it. And then finally, hormonal effects. Long-term heavy alcohol abusers can develop hormone-related disorders, typically related to disrupted reproductive functioning. Now, acute physiological toxicity, the biggest risk that we face here is alcohol overdose, and this is one that university communities tend to be pretty familiar with. So you may have heard of these types of symptoms before. It's relatively common and it can be extremely dangerous. So if someone drinks enough to pass out, it's very important not to leave the person alone. You may have heard this already. It is really good advice to place the person on their side. This is in case the person vomits, that if they're unable to clear their airway and they're laying on their back, then they may actually suffocate in their own vomit. So if you're able to turn them on their side and then call 911 or take the person to the emergency room immediately, it's important to know that someone who is drunk enough to pass out is at risk of dying. Now, before that point, if someone drinks enough to vomit, this is a warning sign. This is time to stop drinking. That reflex does become suppressed once your blood alcohol concentration goes above 0.20, and because that reflex is suppressed, then your BAC can rapidly reach lethal levels. So definitely the possibility to drink yourself to death, and unfortunately we do hear tragic stories about that in the university setting far too often. So we have this phrase that we use, alcohol poisoning. So it's not a technical term, but it's associated with this group of symptoms. Confusion, vomiting, seizures, slow breathing. That would be less than 8 breaths a minute if you're in a position where you're able to assess that. Irregular breathing, that's a gap of more than 10 seconds between breaths. Anytime you see somebody with blue-tinged skin or pale skin, that's a sign that they're not moving enough oxygen. Hypothermia, that low body temperature, remember the dilation of the peripheral blood vessels, and then unconsciousness, especially lack of arousal there. So all of these are associated with a dangerous level of alcohol toxicity. It's not necessary to have all those signs and symptoms before you seek help for someone. And again, any person who's unconscious or can't be awoken is at risk of dying. So it is serious, and it's not something to take lightly. It's an important time to reach out for emergency medical assistance. All right, so other acute physiological toxicity. The concept of the hangover is not a new one. We've got some lovely Enlightenment era art here. The night before and the morning after. We are not the first generation who's experienced the after effects of a night of enjoyment. So in terms of the clinical definition of a hangover, it's actually not something that we understand very well. We all know what happens the night before, but in terms of the science of the hangover, it's not something that we have a very large body of research on. Many of us may be familiar with the symptoms: nausea, fatigue, headache. Depression can be part of this, anxiety. Remember, alcohol is a depressant, so it's not unusual that we would be experiencing some mental health symptoms along with that as well. Now, possible causes. So what causes these? Well, we know what the immediate precursor was, but in terms of the biology behind it, it is possible that hangover is a minor case of alcohol withdrawal. It could be exposure to the congeners in the alcohol. We talked about that in our first lecture, the things that are added to the alcohol for flavor and color. It could be dehydration at the cellular level. We definitely experience some gastric irritation with high levels of alcohol consumption, and it also could be the accumulation of the acetaldehyde. So many ways that the presence of large amounts of the body can lead to the unpleasant symptoms the next day. In terms of the evidence base for treating hangovers, I always like to tell people what the science says as opposed to what urban myth or urban legend or your group of your friends might tell you. So the evidence-based scientific experiments, we have nothing that will cure a hangover. We don't not have a surefire treatment based on the available evidence. There's some evidence that drinking water and taking Advil before bed may help with these symptoms the day after, but an important warning, both alcohol and ibuprofen stress your liver. They require metabolism in the liver, so doing this on a regular basis, exposing out your liver to alcohol and ibuprofen at the same time, can lead to liver damage. Now, aspirin may be a better choice in terms of these symptoms because of the prostaglandins affected, but it's important again that if you drink on a regular basis, that exposure to aspirin may not be a very good, may not have positive effects for your body. So although it will help with the symptoms, it's not a tool to use on a regular basis. There is some evidence, we've got some mixed results on physical activity while experiencing a hangover. So if you're able to get up and go and work out, you may feel better sooner. But again, we've got some mixed results there. Drinking more slowly, so taking care of the problem the night before. And thinking back to some of our early slides about absorption, if you eat fatty foods and carbs before drinking, that affects the absorption rate of the alcohol and may in turn also help your hangover. And then hydrate. The headache that you experience is basically because of brain shrinkage. So if you're able to keep yourself hydrated during your exposure to alcohol, then you should experience fewer headaches in the morning. Lighter color alcohol has fewer congeners, and so it's associated less strongly with hangovers. And then finally, there is scientific evidence to support our college students' favorite rhyme, beer before liquor, never been sicker. There's actually evidence to support that. So some things that you can use perhaps in your own life, or if you're a non-consumer, then you can pass them along to people in your life who may be interested in advice like this. So this is what the evidence tells us. Okay, so now we're moving on to chronic toxicity, not acute, but long-term exposure. And in heavy users of alcohol, because of that effect on brain tissue, we do see brain tissue loss and an associated cognitive impairment, as you'd expect. Wernicke-Korsakoff syndrome. And we can also see heart disease. Chronic heavy alcohol use is associated with cardiomyopathy, myocardial infarctions, hypertension, stroke, a long list of heart disease-related effects. Although there's an interesting relationship with moderate alcohol use. We've heard the evidence of 1 glass a day for women and 1 glass of wine a day for women and 2 for men may actually reduce heart attack risk. There are very few medical professionals in the United States who would tell you to begin drinking to protect your heart if you're not already a drinker. But if you are consuming alcohol, there are those who would tell you that consuming a glass or 2 of wine a day may help to reduce your risk. And then, of course, because of the stress that the liver is placed under, we see liver disease associated with chronic heavy alcohol use, hepatitis, fatty liver disease, and cirrhosis. Got a lovely picture of a diseased liver over here. Alcohol definitely takes a toll on the body when it's exposed to chronic heavy use. We talked a little bit about reproductive effects a few moments ago. Another one, fetal alcohol syndrome. So this doesn't affect the mother, but one of the reasons why there's such strong warnings and advice about drinking during pregnancy is because of fetal alcohol syndrome, or FAS. So if a child is exposed to high amounts of alcohol in utero, and actually the amount is in question, so we shouldn't say high. If a child is exposed to alcohol in utero, we may see these facial and developmental abnormalities. Now this is related to the highest level that blood alcohol concentration reaches and to the duration of alcohol exposure. Women who don't know they're pregnant yet and may have been drinking before they knew they were. This is rarely a concern just because of these stages of brain development. So it's also related to the rate of fetal growth. In terms of prevalence, we do see a little less than 1 to about 1.5 cases of fetal alcohol syndrome per 1,000 births here in the United States. And to diagnose it, we'd be looking for growth retardation before or after birth, a specific pattern of abnormal facial and head features, and then evidence of central nervous system abnormality. And this is a lifelong condition, although we do have interventions that may help children who are experiencing fetal alcohol syndrome to reach their highest level of potential. These are lifelong effects that the children will experience. That's part of the reason why that advice against drinking during pregnancy is so strong. So we also know that drinking during pregnancy increases risk of spontaneous abortion. Women who are consuming alcohol while pregnant are more likely to experience miscarriage, and also that the prevalence of alcohol-related effects in any birth, not necessarily fetal alcohol syndrome, but any kind of abnormality, is actually higher, 80 to 200 per 1,000 births. We do have we don't have firm data on either side. We don't know for sure that low levels of alcohol are safe or that they're unsafe. We definitely know that high levels of alcohol are unsafe. That one's clear as day. But in terms of low levels of alcohol, we do not have evidence that it's safe to drink during pregnancy, and we also do not have evidence that it's unsafe. Because of the lack of evidence on either side, most medical professionals in the United States come down on the side of not drinking during pregnancy, especially after a woman knows that she is pregnant. Most medical professionals in the U.S. will advise that the woman abstains from alcohol during the duration of the pregnancy. So when we talk about dependence, we talk about withdrawal syndromes, right? So we definitely have withdrawal syndromes for people who are dependent on alcohol consumption and try to stop. And it's actually the withdrawal syndrome that chronic heavy alcohol abusers experience is more severe and more deadly than opioid withdrawal. If untreated, if a person tries to go through this withdrawal on their own, the mortality can be as high as 1 in 7. We've got 4 different stages that a person dependent on alcohol will experience when they try to stop drinking. The first stage is tremors, rapid heartbeat, hypertension, so increasing blood pressure, heavy sweating, loss of appetite, and insomnia. Moving on, the person may begin to experience hallucinations, auditory, visual, and tactile, so they may feel things that are not actually occurring to them. At stage 3, we get delusions, disorientation, then just general delirium, and then stage 4 can include seizures. So clearly this is a long list of very serious medical symptoms, and this kind of detoxification should definitely be carried out under medical supervision, and most experts recommend an inpatient medical setting. We do know that if patients are given sedatives at stage 1 or 2, then it can prevent the most serious symptoms of stages 3 and 4. Okay, so when we talk about chronic heavy alcohol abusers, we have to talk about AA, Alcoholics Anonymous, has a very strong cultural presence here in the United States, and they have a unique approach and perspective on how a person who's dependent on this substance should go about reorganizing their life. That 12-step approach, it's actually become very popular, and it's moved on to other kinds of treatment programs in other settings. Basically, AA views alcohol dependence as a progressive disease, and that it's characterized by losing control over your drinking over a period of time. And because of this view of the disease, the only possible treatment is to completely abstain from alcohol. This is not the approach that every treatment program takes, but this is one of the basics of the Alcoholics Anonymous view. So they do approach dependence as through the disease model, that alcohol dependence is the primary disease, and it's not the result of another underlying problem, say perhaps a mental health problem or a genetic abnormality. Now we do have an alternative view. We talked about different approaches to dependence in our earlier lectures. Now the APA it defines alcohol abuse and dependence differently. They include those psychosocial components in their definition, and they consider alcohol dependence a complex psychosocial disorder, so related to that desire to change reality, perhaps lack of coping skills, all sorts of complex components that could be included. But they do include that loss of control that the Alcoholics Anonymous view does focus on. So if this discussion of alcohol and dependence on alcohol raises some questions for you, either you personally or for friends or family members, and you're wondering about whether it's time to make some changes on your own, or perhaps to intervene or discuss with a close friend or family member, there's a couple of general guidelines that people use to approach this. Definitely worth spending some time on the internet looking for some checklists and some guidelines. But one general rule that I like to use is that alcohol consumption is a problem when it causes problems. And those problems may be personal, they may be work-related, they may be academic, they may involve your relationships. But basically, if your alcohol consumption is causing problems in your life, or if that's going on for a friend or family member, then it may be time to start to address the situation. If you are interested in campus resources to help address dependence, there's a group that meets here on campus called Hyper, Helping Young People Experience Recovery. We've got their website there. The last I checked, their meetings were on Wednesdays from 12 to 1 in the Rebel Wellness Center. It's worth double checking on that because their schedule does change sometimes with different semesters. So if you'd like to double check, you can check their website and see what the current meeting schedule is. One thing about living in Las Vegas is there's virtually 24-hour a day, 7-day a week access to meetings for AA and other organizations like Al-Anon and SMART, who have a very high-profile presence here in the city and are definitely there to help if this is a problem for you or for someone in your family. Please feel free to post any questions you may have about this issue in our content discussion board. If you're looking for general guidance on how to help a friend, that sort of thing. If any questions you have may also be helpful for a classmate as well. This is one of our most common forms of dependence here in the United States. So if you are experiencing concerns about this, you may not be the only person in our class, and you're definitely not the only person on campus right now with those concerns. So wrapping up our discussion of alcohol, we started by talking about cultural attitudes. We've got celebrity sponsors for brands of alcohol, and then we've got celebrity sponsors for sobriety. So definitely some dichotomies in the United States in the way that we approach this here. We talked about the differences between fermented and distilled products and how that can affect the level of alcoholic content or proof. We talked about the political and legal history of alcohol and alcohol consumption here in the United States. Some current consumption patterns and how they've changed over the past several decades. And then we went through the pharmacology and metabolism of alcohol. We dug into the behavioral effects of alcohol, and then we just finished wrapping up our physiological effects, our most important reproductive effect being fetal alcohol syndrome, and then finally we covered alcohol withdrawal and dependence. So that will finish us up for alcohol, and I will see you next week.